Assalamu alaikum everybody. I hope you are fine inshallah. Today is our first lecture. It's about the pathology. And because we are working in the laboratory department, so we should understand what is our branch, in which field we are working. So first of all, we will just do the definition of pathology. What is pathology? Usually it's come from the Greek word pathos means disease and logos means a trait, a treatise. Simply, we can define as pathology is the study of disease. When we are studying the disease to know the cause of the disease, so that is calling the pathology. In pathology is the branch of medical science in which we deals with the essential nature of disease and the changes in body tissues and organs which cause disease or caused by disease, because two options are there. Maybe the changes came in the tissue or in the organ because of the disease or after the disease. So this two is there. And the third we can define as the structure and the functional manifestation of disease. So this is simply pathology where we are studying. And then we are particularly working in the laboratory department. So first of all, we should know what is laboratory. Laboratory means a room or a building equipped for the scientific experiment, research or testing, or used for the manufacture of drug or chemical. So any kind of room or any building where we keep some instruments, and that is equipped with the instrument, and here we are doing some kind of test, or we are doing some researches, or we are doing using as per the testing. So that is calling the laboratory. For example, research laboratory is food laboratories, but we are working where that is calling medical laboratory or clinical laboratory. So here we will explain only about the medical laboratory and clinical laboratory. A medical laboratory or clinical laboratory is a laboratory where tests are carried out on the clinical specimen to obtain information about the health of a patient, to aid in diagnosis, treatment and prevention of disease. For example, if we see one unconscious person are there, so we don't know if the patient glucose level is high, if that is hypoglycemia or hyperglycemia, because he cannot speak, and we don't have idea about that. So if, like that condition, the doctor cannot do any kind of action for that one. So first of all, we have to diagnose that one. If the sugar level is high, so maybe the doctor will use insulin and some other kind of test to decrease the level and become in the normal condition. Or maybe some patient are there, their glucose level is going to decrease. So because of that also they are going on the unconscious conditions. So in that condition, maybe the doctor will advise and give him some dextrose like that kind of things to increase his glucose level. And also we are using it for the prevention of the disease also. For example, hepatitis B antibody, without that the doctor cannot understand, and we cannot understand whether the patient is immune for the hepatitis B or no. Without doing that test, it's impossible. And usually our laboratory is located in the hospitals only. So first we will see hospital almost consists of three kind of medical staff are there. Doctors, we are thinking about that they are the brain of the hospital, because from them only every commands are coming and we are following that one. And nurses, so we are thinking that the heart of the hospital, because only they are the one they can transport the oxygen to everywhere to survive the hospital. In laboratory are also very important part of the hospital, because we are thinking about it, this is the backbone of the hospital. Because if we see any partner degree holder doctor or professor, he cannot do anything without our investigation. If you are matriculate, after that you do the diploma holder technician, but if you cannot give the proper result, so he cannot do, because of your result almost 70% of the depending of the patient treatment is depending on your investigation only. So we should think about that. So that's why we are calling laboratory is the backbone of the hospital, in both side, not only for the clinical purpose, for the financial purpose also. Liberty is giving very important role to run the hospital as a normal condition without any problem. So this is today our lecture was about the pathology. So simply we can define as pathology is the study of the disease, and there we are working. So that is calling laboratory, and there are different kind of laboratory, but we are working in the clinical or the medical laboratory only. Inshallah, the next lecture we will just study about the branches of the laboratory, like what kind of thing we are doing inside a medical laboratory, for example biochemistry department, hematology, clinical pathology, or other kind of endocrinology, like that. So that will explain inshallah in the coming lecture. Thank you so much for watching us.